The most at-risk generation, STIs among young Americans, and the toolkit that can fix that. A closer look at why adolescents and young adults have a disproportionate STI burden. Written by Diego Castaneda. Overview: STI burden and public health response. Over 2.4 million STI cases, chlamydia, gonorrhea, and syphilis have been reported in the United States. Nearly 48% of these cases occur with people between the ages of 15 and 24, despite being a smaller share of the American population. Chlamydia, 1.6 million cases most common. STI, 4, gonorrhea, 600,000 plus cases, and syphilis, 209,000, including rising congenital cases. HHS Strategic Vision, STI National Strategic Plan, prevent new STIs and reduce transmission, expand access to high and affordable health care, eliminate stigma and discrimination against people who are seeking medical help, promote sexual health education and awareness. My plan is to create, quote, a future where STIs are prevented and all people have access to high quality and stigma-free care. Health disparities. A large number of cases occur in African American communities, with 32% of them suffering from STIs, disproportionate to population share. STIs in today's world have a higher impact on young people and people that live in underserved communities. Prevention and action. Protecting young adults. Use protection every time. Condoms and dental dams help reduce getting STIs. Easy, affordable, and effective. Many STIs have no symptoms, so get tested early as a way to protect others, and talk openly with partners and know your status and theirs when it comes to health. Connection to the HHS Strategic Plan emphasizes prevention, education, and early detection, supports stigma-free and accessible sexual health care, and encourage youth-friendly outreach through social media. Treatment and testing guide. Ask and test. Ask yourself, am I at risk? Talk openly with your partner about STIs. Ask a healthcare provider about which tests are needed. Test. Visit a clinic, doctor, or a community health center. Request. STI screening. Many tests are quick, confidential, and cheap. Treating STIs. If a test comes out positive, don't wait. Start treatment right away. Many STIs are curable. Follow medication instructions exactly how they are written. Avoid any type of sexual activity until cleared by a medical provider. Stigma and equity. Breaking myths and promoting fair care. Myth 1. Only people who are careless get STIs. Truth. Anyone who is sexually active can get an STI. Risks are influenced by the lack of education, testing, and healthcare rather than just personal choices. Myth 2. You would know if you had an STI. Truth. Many STIs actually have no symptoms, which is why it is extremely important to get tested for it. Myth 3. STIs can only affect certain groups of people. Truth. STIs can literally affect anyone, no matter their race, religion, or sex. Myth 4. Getting tested is embarrassing. Truth. Testing is a normal part of healthcare. Clinics are a normal part of healthcare. Clinics are confidential and focused on respectful, stigma-free care. Equity focus. Health disparities are linked to limited access to care, stigma, and socioeconomic factors. Reducing stigma helps people feel safe and comfortable seeking testing and medical treatment for STIs. Everyone deserves high quality, respectful, and inclusive health care. Call to action. Support youth STI prevention care. Trusted resources. U.S. Department of Health and Human Services, STI National Strategic Plan, Centers for Disease Control and Prevention, STI Data and Prevention Resources, Office of Population Affairs, Adolescent Sexual Health Resources, Planned Parenthood, Testing and Education Services. Call to action. Take action, get informed, get tested, and advocate for better healthcare services in your community. because young Americans deserve to have a healthy future. And these are all the resources and links I've used. Thank you.